Thanks for staying with us. So, despite the rising cases of coronavirus in the country, most schools across the country are resuming physically for academic exercise today. The House of Representatives came out through a press release opposing the action of the federal government on schools resumption. Joining us on the show is the President, National Association Proprietors of Private Schools, NAPS, Mr. Yomi Otubela. Good morning, sir. Are you there?
Thanks for having me.
Yes, good to have you.
You will recall that last year, September, the NCDC and WHO gave protocols, COVID-19 protocols that are supposed to be maintained within the school environment. And these we did within the school last term, and all these protocols are still in place. We have equally done a refresher program for all teaching and non-teaching staff before resumption.
Is it agreed within private schools to test teachers before resumption and after resumption? Has there been a spike in infection of teachers during the past term? Do you have the numbers for cases of teachers getting infected?
Thank you. There is a policy in place that anyone who is ill or show any signs of sickness, either it is COVID-19 or not, especially when such person is among the stakeholders within the school system, such a person will be subjected to a test of COVID-19 and we will have to seal the clearance and negative results to allow such a person to return back to school, either a teacher or a student. I must add here that we have not recorded any teacher in the private sector who is down currently or in the past when we resumed for last term for COVID-19 related.
Okay. All right. Yes, Dr. Akase, let me come to you because you've heard what Mr. Otubela told us about preparedness of the private sector. As somebody who's heading the Infectious Disease Unit at LUTH, in your view, is it a good idea to have the children come back to school?
I think generally what we've observed and what has been responsible for the rather rapidly increasing number of cases has simply been the inability of society to adhere to what has been known. Why schools may be safe, schools do not operate in isolation in society. If parents will need to take children to school, there's going to be a lot of interactions that will emanate from schools opening. So while I have no doubt that institutions have put in place guidelines to make sure that their own staff and patients are safe, there is no argument that asymptomatic people are the major drivers of this rising number of cases in society. It's not even the people with symptoms. It is those that do not have symptoms. Opening schools, unopening institutions passes across the message to the other members of the society that there is no problem and that we can move on with our lives. And this really is what is fueling the behavior of people who are not in institutions, for example, people in the motor parks, people in the marketplaces, people on the roads, who are getting the impression that, there's no problem, that it is okay to move on. And I think this really is the most dangerous aspect of, reopening institutions and saying things should go on, as usual.
All right, let me bring in Professor Ihonvbere to this conversation. Sir, people are saying that there's a bigger picture, that Africa has not been able to catch up in development across the world. We are already still playing catch up. Now, with this COVID-19, it's going to further widen the gap with the West. So the West, yes, there's COVID-19. The kids are having to stay home, but they have options. They are online. The schools are able to continue education online. Africa will further widen the gap of poverty if we refuse to ensure education carries on even in COVID-19. What are your thoughts on this? Do you think it's a must reopen, or do you believe that we should go, as the doctor has said, close schools for now?
Well, I will say that your perspective is quite correct. And the reason why Africa has always lagged behind is because of the quality of leadership. Schools have to open. We have to learn. Unlike Dr. Akase, my brother there, just said, I think he captured it excellently. Right now, we are not prepared. We have not taken into consideration the safety of these children. The fact that they may be asymptomatic or their immunity levels are higher than that of adults, they interact with their parents at home, with visitors. They go to the market, they go on errands. So I think what is happening is that we have reopened schools, but we've not done the necessary, put in the necessary requirements. The Federal Ministry of Education itself set up a template for school readiness. No state has implemented 20% of that, of the template, of the items in this template. Mr. Otubela and I were on the same page. We believe in the house that schools should reopen. But it would be criminal, it would be wicked to open schools where the basic minimum package of compliance with COVID protocols have not been put in place. In school, for example, it's ready. But we feel that this is an opportunity for governments to rise up to the challenge.
Okay. All right.
Have the necessary political courage and political will and vision
right.
to fix these schools. What does it cost to provide water in schools?